everyone. Visible? If I'm audible, visible, I'll start. Okay, so is the voice clear? So I'm in a hotel, so obviously after class, I was in a hotel, so I could not put a green screen. It's not possible. So I'm taking it here. If I'm audible, visible, I'll start. Good evening. Good evening to everyone. So welcome to this PYQ session. Okay, and I'll be starting it in a minute. Just wait for other people to join in. Okay. So I think I'll start. Okay. So we are discussing first the NEET PG 2023 questions. I have already discussed them when there was an exam on the evening of the exam. Okay. I myself gave the exam on 5th of March. After exam, I discussed the questions once again. So this question was there when there's a low insulin and glucagon. That means what? It will lead to activation of which? So this question was actually high insulin lead to activation of. Okay. So otherwise, if it's writing, then it's going to be yes, it lead to activation of our lipase, lipoprotein lipase pathway. Okay, so just change it. If it is high insulin, the answer would be yes, hormone sensitive lipase. Okay, and it causes, thank you, it causes, yes, it causes it, okay, sorry, starvation, fasting. Because the question I saw was different. This is a different question one. So starvation, fasting, all these conditions. Okay, what they're going to do? They are going to activate our high, low insulin. There's a hypoglycemia, and there is yes, decrease insulin, decrease in the insulin. Okay, and what else is activated? Okay, yeah. One second. Okay, I'm just checking. Okay, am I audible, visible? Everything is fine. Okay, so let's continue. Yeah, so I think now people will join in. So basically, if the question is if there is low insulin glucagon, it will lead to hypoglycemia, decrease insulin, and that causes increase lipolysis. That causes a increase in the lipolysis because now you need energy for survival and also hyperglycemia. Okay, now increased glucagon is there. And now it activates the hormone sensitive lipase which break the lipids and increase fatty acids and cause increase fatty acids which are then used for ATP synthesis via oxidation. So the answer is A, hormone sensitive lipase. Yes, it's a PYQ. I think it'll come soon 5.0. Don't worry. Okay. 35-year-old intravascular hemolysis increase potassium. See, remember it is a hyperkalemia. And if you remember my classes, I told you hyperkalemia causes depolarization. Why depolarization? Because the potassium cannot come out because it reduced. So why? Because of more potassium outside, less can come. So less potassium can come out due to hyperkalemia. And that's why cell become, yes, so it become less negative, or you can say more positive. What is that called as? That is called as depolarization. So the answer will be more positive, that is less negative. The answer will be depolarization. Okay. I don't know about the pre-booking. Will be updated by the team soon. Okay. Okay. Which phase of the ventricular action potential is given below? So let's have a look. First, phase 0. What is the cause? It is sodium voltage gated. Phase 1 is potassium. Phase 2 is calcium L channels. Phase 3 is again rectifier potassium channel. Rectifier potassium channel. Okay. And phase 4 is RMP. So calcium channel open in phase 2, it's true. Potassium close in phase 0, it's false. It's open actually. And then transient calcium channel open, it's again false. Calcium close phase 4, no. They are closing in phase 3, false. So answer is A, calcium channel cause the plateau phase. This is a plateau phase. This is a plateau phase, okay? So yeah, I'll be giving the exam. Yes, Stephen, I'll be giving on 23rd of June, hopefully in any of the center near you. Okay. Next question. Preterm baby. I'm just doing it fast because all of these have been discussed already in the classes. So it is, yes, respiratory neonate, respiratory distress syndrome. Okay. What is the reason? It's basically lack of surfactant. So there's a decreased surfactant. And again, this I've discussed in class that cause increased surface tension and compliance will decrease because it causes collapse. So increased surface tension, collapse alveoli, and the expansion of the lungs become difficult. So that is why there is, yeah, I'll do authentic recall. I want the best recall, at least in physiology. No one said choice what the exam language was. Exact language question we discussed. So collapse the alveoli, and that's why difficulty in expansion of lung. Okay, difficult breathing. Difficult breathing, and that causes our, yes, decreased compliance. So compliance is decrease. Yes, so compliance is decrease in this particular case. Okay, so compliance will be decrease. So answer is A. Next, this transport, let's see, this is more concentration, this is less concentration, and the molecule is going here. In the exam, they showed an arrow also. Okay, so it is going from more to low. So it's passive, it cannot be active. Why? Because going from more to low. So it's passive transport. And it is via transporter, passive via transporter. So what will be the answer? Anyone? Anyone? Tejasvi, Suman, Green, Dr. Stephen? Obviously, it is facilitated. So it's the facilitated one because transporter is helping. If no transporter, it will be passive. If against using a pump, it is this, and secondary active is symport. So I'll just write pump is primary active. I discussed that in class so many times. Is primary active. And if sodium symport, it is secondary active. It is secondary active. Okay, secondary active. See, PYQs are not repeated, topics are repeated. I'll show you so many questions have been repeated multiple times. Like I'll give you a list of topics which are very important. You can do it and they are very, very essential. Okay, let's see next. Regarding cardiac, again, we have discussed that it's a, again, see, some of the question you'll see is same. Already have discussed. So phase 1 is due to sodium, false. It is due to phase 0 is sodium. Phase 1 is closer. It's true. It's true. It's true. It's true because phase 1 is close and there is a potassium. Phase 3 due to closer. No, phase 3 is potassium, false. Phase 3 due to no. Phase 2 is due to phase 3. It's also true. So I think both this 1 and 3 is true. Okay, 1 is also sodium channel close. Phase 3, the potassium channel will close. Okay, clear? But rather we'll go with this phase 1 because phase 3 is due to, again, I think this is a recall typing mistake. It should be something else. Okay, so I'll just modify this question. Both in this question B and C are right because these questions were again recalled by students and given to us. So B and C are correct. And what should we go for? Again, both are equally right because one, slope they are asking. Slope should be potassium and phase 3 should be again potassium. So I don't know what to go for. Both B and D are right. Okay, B and D both are right. Okay, both are right. Both are right. Okay, because 3 is due to closure of calcium channel and opening of rectifier potassium. I discussed already. Okay, so right now let's go for B. We are going for B because that is the first to occur. Okay, in the exam it was not like this. Okay, exam it was not like this. Okay, in this graph, what is the case? Let's label this is IRV, this is TV, This is ERV, this will be RV. In the exam, it was actually this one. FRC was the answer. So exam, again I'm telling you, these are recall question not by me but by students. So this was the exam, actual answer was FRC. I myself gave the exam. So here the answer is, red arrow is ERV. So this exam I have going to go do the proper recall. Okay. So I'm just giving you the recall question I got. These are a bit different from the actual ones. Don't worry about that. Next question. Let's see this question. B2C is opening of sodium. Yes, it is true. Yes, it is depolarization. This is repolarization. Point C2E is due to potassium channel. Again, this is C2E. Again, it is true. Then E is due to slow closure of, no, this false. It's not the case. B2D is refracted. It is also true. So only one is wrong. F, so it should be which of the following is incorrect. Then the answer should be C. So C is the answer. So we'll go for C because these are all other true. Okay, understand? Na? Sometimes you'll get the questions recall which are not accurate. But in the exam, I myself say all the questions were accurate in their description. Okay, language was tricky, but questions were correct. In this question again, this is not the true. Okay, so B2C is sodium, that's true. Then C2E is potassium channel. Yes, they remain open. And then E is due to, again, is false. So answer should be C. Okay. Next question. Clearance is given which? Now remember, PAH initially is very high. PAH is initially 100% cleared. So clearance is equal to RPF. This is RPF. But afterward, it cannot be, yes, 100%. So that's why its clearance false. But later, clearance fall. So this substance is pH. Inulin is neither secreted nor reabsorbed. So this X is inulin which remains GFR. This is inulin. X is inulin. Multiple time asked in the exam. Okay. Yeah. Fine. And then comes Z. Z is 0 in the beginning. Then it rises. This is glucose. Z is glucose. Why? 0 in the beginning. Clearance is equal to 0. Why? 100% reabsorbed. If it's 100% reabsorbed, nothing comes in urine. Yeah. So it should be, yes, 0. But later, glycosuria occur, increase clearance and glycosuria occur. So the answer, tell me, what should be the answer? Yeah. So answer should be, X should be our inulin, pH should be Y, and Z should be glucose. The D is the answer. So go for D. D is the best answer out of all possible options. D. Okay. I think there's a lag between chat and this. I see chat later on. So D will be the best answer. Okay. D. Both B and D here. B and D both are right. B and D, B and C. So, okay. Let's move. Okay, let's see the questions of 22. Okay, this is the question phase B. So temperature is, yes, there. So how do you increase? So basically by shivering, true. Sweating is false because that cause loss. Brown fat is in, again, is not increase, it is metabolized. It is rather lipolysis. It is true, but again not increase, it's rather broken down. It decreases. Brown fat will decrease. Dilation, false, never occur. So that's why we'll go for answer number A. Shivering causes the increase in the temperature. Shivering causes the increase in the body temperature. We'll go for answer A. Answer number A. Okay. Next, see the question. The following is effectively proven way. तो बताओ भाई क्या करना चाहिए? Okay. Exercise, true. Decrease stress, true. Red wine, yes, it has sirtuin. And this is also true, is called as calorie restriction. Calorie restriction, which I practice. That's why I don't look like I'm 50-year-old. So I'm 50 year. Which graph? Which one? Kunal, which graph? Okay, I'll take all these doubts in the end. You tell me, I will cover up. Okay, clear? Let me just do the answers. I'll take the doubts later. Okay, so restriction is there. So calorie restriction is there. So restriction is the best. It is the best. Okay, the best. Okay, yes. Patho also most effective. Okay, clear? Yes. Now identify. So this is a graph of cystometrogram. Okay, cystometrogram. 1A is the initial filling phase. Is false. Is not the initiation. Is the false. 1A is initial filling. Then 1B, what occurs? This is your plasticity phase. Plasticity. So the plasticity phase. What happens in the plasticity phase? The pressure is low. Pressure is constant and low. So pressure is constant law. Why? Laplace law. What does it say? I'll write here. Space is not there. So P is 2T by R. So as the radius increase, tension increase, pressure remain the same. So what happens? So increase radius and increase radius keep pressure low despite high wall tension. So this is called as Laplace law. So 1A residual no, it's the initial phase, again false. 1B represent Laplace, it is true. This is perfectly true. This plasticity phase and true. D, pressure is increasing by amount with the amount. No, it is not. It's false. It is same. The pressure remain same. So the answer will be C. So C is the right. Yes, you all are right. C is the right answer. Okay. What is this signaling? It is acting on adjacent cell. So this is a type of paracrine. Autocrine is act on itself. Apocrine is a gland, skin gland. It is for secretions. It's not a action. Endocrine is via blood. Via blood. Act at far away sites. So if you act at far away site, it's called as endocrine. And if they would have given you juxtacrine, that will also be the right answer. Juxtacrine is act on adjacent cell. So that is juxtacrine. Okay. Yes, juxtacrine. Okay. Fine. Okay. So answer is A. Paracrine is nearby cell. Okay. Very good. Keep it up. What of the following feedback is involved in baroreceptor? Now remember, it's a negative feedback. Increase BP, activate the baroreceptors, increase baroreceptor activity, and they decrease the BP and decrease the heart rate. So they will via which now vagus. So via vagus, they decrease the BP, decrease the heart rate. It's an example of negative feedback. Okay. In fact, all regulatory system are negative feedback. Yes, it's a negative feedback. No issue in that. Okay. Okay. I'm going fast because most of these questions already are known to you. If there's anything controversial, then I will go and discuss. Okay. Very good. A child present with loose stool or ORS. So ORS contains sodium and glucose. Why? Because they are needed by SGLT. Now remember, if SGLT1, it is GIT, SGLT2 is kidneys. So if ORS is given, must be SGLT1 is the best answer. So remember, if they are mentioning ORS, it require both. It should be GIT is one. Yes, you're right. Yes. Very, very good, Dr. Raksha. Yes. Let's move next. A laborer come dizziness, fatigue, hot climate, temperature is 42. Okay. His skin show poor turgor. Okay. All of the following can be present. So it's most likely they are mentioning heat stroke. So heat stroke, the temperature is above 40. Above 40 degree. Above 40. Sweating is absent. Hypotension can occur. Okay. Tachypnea can occur. Nausea can occur. Dizziness can occur. But remember, main thing is sweating is absent. So answer should be A. This is again a PYQ. Sweating is absent in our heat stroke. Okay. A research was done. Electrolyte sodium is 10. 10 is low, and potassium is high. So it's obviously ICF. All these three have low sodium. Sorry. Interstitium will also be similar. Okay. Interstitium, ECF, interstitium plasma. They have low potassium, high sodium. Okay. So they all have low potassium. So answer should be ICF. In the cell, sodium is less, potassium is more. Yes, you are all right. Very good. Very, very, very good. Chalo. Let's move to next question. Okay. Patient present epinephrine. Okay. Bronchodilation must be which asthma? Brittle asthma. Because in brittle asthma we use the adrenaline. Now beta adrenergic. So we know that beta 2 is the answer. Beta 2 use cyclic AMP. GPCR, adenyl cyclase. Yes, you are again right. Adenylate cyclase. Guanyl is cyclic GMP. IP3 DAG is for calcium contraction. Tyrosine is PIG. What is PIG? Prolactin. One question always come from receptor. I'm not joking. Be very, very, very prepared. Growth hormone and this. So that's why answer is A, adenyl cyclase. Yes, Dr. Zenon, Arunava. Yes, Itachi. कैसे कैसे नाम रखते हैं बच्चे? Itachi Uchiha. NEET PG 24. Sildenafil. Oh, नाम है ये. Supriya, Swap, Dr. Jan. Okay. Let's go next to 2020 questions. First, identify the sleep. So remember, this is which way? Beta. This is alpha. This is theta. This is delta. Why? It is very fast. It's sawtooth. So NREM stage 1 is the theta. These two are theta. 3 is delta. So answer is REM. REM shows beta wave. REM show beta sawtooth. So beta sawtooth activity is seen. So beta sawtooth. Yes, yes, yes. So answer is our D. In preterm baby with respiratory distress, what cells? So obviously, again, this is 100 times asked question. Again, it is type 2 alveolar cell. It make the surfactant, okay, not ND capillary cells or the mucosal cell. It's type 2 pneumocytes. B is the answer. No need to even discuss B. A young man with motorbike injury to ileum is there, jejunum is there. Then entire ileum and jejunum is rejected. Which will he suffer? So obviously, if they are removing the jejunum and ileum, what cannot be absorbed? Vitamin B12. So that will cause megaloblastic anemia. Diarrhea, again, why should diarrhea be there? Ulcer, again, stomach is constipation, again. So that's the best answer is vitamin, yes, B12 deficiency, yes. You're all right. Is the voice? Please check at your end. My end voice is coming clear. Yeah. So beta sawtooth activity is seen. So beta sawtooth, yes. Okay, I'm using my laptop here. I don't have any studio facility. Yeah. Okay, B12. The reflex in which there is an inhibition of gastric emptying when there is acid and hypertonic solution in duodenum. Remember, this is called as enterogastric reflex. What happens? I'll write down here. Acid in duodenum inhibit the SCL and gastric emptying. It's a negative feedback. How? Via what? Via what? Via, yes, this CCKPZ, secretin. This is enterogastric reflex. What is gastrocolic? I'll write here. What is gastrocolic? Food in stomach It causes increased defecation. This gastrocolic. This is gastrocolic. So food causing defecation is called as a gastrocolic reflex. So gastrocolic reflex is the name. Okay, food causing the defecation. Okay. So here secretin, also enterogastrone, so many are there. All play a role in this case. Okay. Now, in multiple sclerosis, it's very, very important disease. There's a sclerosis and there's what? Damage to oligodendrocytes. So, oligodendrocytes, Uthoff phenomena, Uthoff. That is, symptoms are worsen in hot weather, Uthoff, garmi, Uthoff. And there is sensory like needle-like pricks when you do barber chair, the neck flexion. That's all Hermite sign. So Hermite sign, sorry. So this is basically loss of myelin sheath. So oligodendrocytes, myelin sheath is lost. So answer is B. That is the answer. Okay. Yes. Now nitric oxide. Again, it is from L-arginine. Enzyme is NO synthetase. NO synthetase is the answer. D. Arginine. Proteoglycan which is present. So keratin are actually glycosamine. Okay, so they're actually glycosamine. So it's not the answer. Answer collagen is a protein. Heparan sulfate. It give negative charge to BM basement membrane and prevent filtration. Prevent filtration of negatively. Yes, you're right. Charge plasma protein like albumin. Example albumin. So answer should be yes, right? C is the best answer in this case. C. क्या बात है सुनील? Sunil is writing C with SEE. Great, boy. Very good. Okay. Yes, you're all right. Dr. Rajat, Supriya, Sunil, Plutus, Anushita, Sharvana, Arunava, sorry. Jhansi, Mumal, Itachi, all. Very good. Okay. Albumin, yes. Which of the following clotting factor patient warfarin? So we know warfarin, it inhibit vitamin K. And vitamin K, see again, this was asked in this year exam also. It is not shown in the PYQ file because again, maybe it put in biochemistry or pharma, but came gamma carboxylation of glutamate residues of glutamic acid of factor 2, 7, 9, 10. So answer should be A, factor number 2. Kya baat hai? Very good, very good. Okay. Very good. Okay. I think you all have either done PYQs or you are preparing for the exam very well. I think you all are going to get a very great rank. Very, very good. Clap for you. Yes, very good. So answer is A. Very good. Water hammer pulse. Again, it is also, so it's what? Sudden collapse, also called as what? What the other name? Yes, collapsing pulse. So this is what happens. So when you raise the hand, suddenly the pressure fall. So the fall in pulse volume on raising the hand, and it is seen in aortic regurgitation. Okay, so the pulse is not sustained very well. The moment it again regurgitates back, so that's why pulse will suddenly decline. So called as collapsing pulse. Collapsing pulse. Very, very, very good. Perfect, perfect, perfect. Corrigan is carotid. Don't get confused. Corrigan is dancing carotid. It's not corrigan. Corrigan is dancing carotids. So don't be confused. Corrigan is dancing carotid. माइकल जैक्सन बन के डांस करती है बिल्कुल. ठीक है, चलो नेक्स्ट इज bisfrins is yes. Bisfrins is basically HOCM, double peak. 65 vascular to inferior frontal gyrus, that is Broca area. So it will be motor speech area 44, 45. So again, these kind of questions are very common. Please be very, yes. Okay. A boy met with a motorbike accident, CT again, superior temporal gyrus. So that is what? Wernicke's area. So what will Wernicke's area lesion cause? Wernicke. So let me explain you. Wernicke's area. Okay. So it will lead to, see, global is multiple area, non-fluent conduction. I'll just write the ones. Global is multiple area affected. Non-fluent is seen in Broca area, Broca lesion. Conduction aphasias, arcuate fasciculus, arcuate fasciculus. So answer is D, sensory aphasia, also called as fluent senseless speech. So fluent senseless speech. Yes, you are right. D is the answer. Very good. I think you all are going to just get 600 plus in the exam. All of you. Very good. Very, very good. Next, pH is 7.2. That is low. That is acidosis. Bicarb is also low. That is metabolic acidosis. CO2 is also low. That show it's a respiratory compensation. Respiratory alkalosis for compensation. So the right term is it's partially, because pH is low, partially compensated metabolic acidosis. The answer should be C. Partially compensated metabolic, yes, condition. Are you clear? So partially compensated. Yes, you are all right. Very, very, very good. Perfect. Let's see next. Okay. I'll just come in a minute. Okay. I have to receive my food. Just give me 1 minute. I'll come. Okay. 1 minute. I'm back. Sorry. I was there to pick the food. Okay. So the answer is yes. Metabolic acidosis. Let's see next question. Which of the following condition would cortisol be highest? So obviously cortisol is increased in Cushing's. Addison disease should be low. Dexamethasone should be low. Waking should be high because morning is the highest. So again, the answer will be C. Highest level is in the morning when the person wakes up. Very, very good. Yeah, I am in hotel, bhai. After class, we all faculty stay in hotel. We can't go home. So that's why it's the place we all are in. Yeah, I'll have dinner after this session. Okay. I took class 8 o'clock. I came to the 7:40. I came, started this. After the session, I'll eat. Okay. Chalo. A 55-year-old male present with tachypnea, mental confusion, glucose is very, very, very high. pH 7. It's a classical what? It is your diabetic ketoacidosis. Ketoacidosis. So diabetic ketoacidosis. And what is the finding about the diabetic? It is a nagma hagma. It's a high anion gap metabolic acidosis. So high anion gap, yes, metabolic acidosis, Hagama. So I will go for metabolic acidosis, sorry, metabolic acidosis C. C is the right answer. You are all right? Yes, C. With the following bind to tyrosine. Remember, it's pig hormones, pig. What is pig? Prolactin, insulin, and growth hormone. So we'll go for insulin. These others are GPCR. GPCR, GPCR. Okay, so they are GPCR. Very good, very good. Yes, Dr. Prachi, you're right. Insulin is the right answer. Now, what does VQ infinity means? VQ means basically blood and air. It is the air versus blood. So if VQ is infinite, means blood flow is zero. Blood flow zero. What that mean? That means there is an infinite VQ ratio. That means zero, no exchange. So what does the air remain? So air remain unexchanged. So air is not exchanged. So that is called as dead space. So it will be dead space. Now we'll say 159. No, that is atmospheric air. That is atmospheric air. But CO2 is our alveolar air. So how can it be 40? So if a person is dead space, there should be dead space. If someone says that it should become atmospheric air, I agree, it should be atmospheric air. But point is there should be some carbon dioxide there in the alveoli. But here it is 40. 40 is not possible. 40 means it is breathing. Atmospheric air is 159. Alveolar is 100. So alveoli air has PO2 of 100. So that's when none of them match. O2, how can it be 100 if oxygen is not exchanged? So spasm is again not right. So answer is A. Dead space is the case. Okay. Where prolactin is given? Which question? Okay, prolactin is given, then we can go for again prolactin, but tyrosine best answer is insulin. Insulin is the best answer for tyrosine kinase. Okay, Dr. Manoj? Okay. C wave, again it's very simple. We know atrial systole cause A, filling of the ventricle. So ventricle is asking. So ventricle filling passive. Yes. So it causes our yes Y descent in the JVP. Relaxation X, and this causes C. So it causes bulging during isovolumetric contraction. So that should be yes C. So there's a C wave in the JVP because of contraction. Okay. Answer is A. I'm discussing fast because these questions are already discussed to all of you. Okay, RDS, again, I'm telling you 3 questions I can recall only from this topic. Okay, so it's what? It is DPPC. DPPC, also called as lecithin, is the main protein, main phospholipid. Proteins are not the main, so the best one. Sphingomyelin is minor. Okay, it's minor. So best answer is DPPC. DPPC. Impaired function of aquaporin. So remember, Liddle syndrome is ENaC defect, increase ENaC. Von Hippel-Lindau, again it's a transport disorder. Barter is NKCC block. Okay, nephrogenic basically is answer. Here what happens because of C, ADH act on CD via aquaporin 2. So if the aquaporins are not working, ADH fail to act despite high level, that is nephrogenic DI. So we'll go for nephrogenic DI. That means the ADH is not able to act. That's called as nephrogenic DI. Vitamin B12, again multiple time, it's animal products. That's why vegetarian have a deficiency. So that is why vegetarians are deficit. So best answer is animal products. So best is animal products is the answer. So animal products. Okay. DPPE बोला तो ये डाई पामिटॉइल फॉस्फेटाडिल कोलिन DPPC है भाई, शॉर्ट फॉर्म है इसकी. ओके, लेट्स मूव. That's why vegetarian have what disease? So veg people have B12 deficiency. This was again a PYQ. Yeah. A 50-year-old man presents with paresthesia, hemoglobin is low, anemia is there, macrocytes, hyper is a classical which condition? It is B12 deficiency, and gastritis most likely due to pernicious anemia. Pernicious anemia because there is a gastritis, atrophy of the gastric mucosa. So what is the best answer? Yeah, so vegetarians can have the B12 deficiency. You might take some supplements. Okay, so answer is B. Okay, answer is B. Transplant between, again, it's a patho question came in mind. So it's a isograph. Isograph. Okay. Isograph. Okay. Xeno is other species. Auto is self. Allo is, yes, similar. Yes. As a cardiolipin you are asking. Okay. Cardiology pin. I don't know what you're saying. Okay. So 2019 question. Let's see. Peripheral chemoreceptor respond to hypoxia. So remember, they have our what cells? Glomus cell. So glomus cell 1 is having what transporter? So glomus cell 1 has potassium channel, oxygen sensitive potassium channel. So which channels? Oxygen sensitive potassium channels are there. So O2 sensitive potassium channels are there. Now, so best answer will be C. Yes, it's again PYQ, potassium channels. Okay. Now, vasopressin, again I discussed already, it is aquaporin to CD, P cells, V2 receptor, GPCR, cyclic AMP, and increase aquaporin 2. So the answer should be, yes, B. B is the right answer in this case. Okay, B. Okay. Identify the blood grouping. So first, you can see here red. Red means it is not clump. It is clumping is only in the D. That means antibodies are able to only neutralize this. So that means what is present? The O antigen is present. So that means A, B are absent. A, B antigen are absent, but O is present. That's why blood group will be O positive. It will be O positive, okay, because clumping is only seen in D. That is O positive. Very good, very good. Next question, Golgi tendon organ is for tension without any doubt. Length is spindle. Pressure is Pacinian corpuscle. Also cross and bulb. Also cross and bulb. And proprioception again by spindle. Spindle can help in proprioception. So answer is A, tension is tendon organ. Okay. Yeah. Next question. Hormone predominantly secreted after 14 days. So 14 days, see, at 14 day there is LH surge. So first LH surge, ovulation 14 day. And then there is increased progesterone. So answer should be progesterone, which cause maximum growth. Okay, so we'll go with progesterone. They are not saying which is increased on 14 day. If they say increase 14, then it should be, answer will be LH. Okay. Testosterone is secreted by Leydig cells, no doubt in that. Leydig cells, okay. And theca cells, they are for what? They are for release of our, yes, estrogen. Estrogen, okay. And corpus luteum, progesterone. Just now we have discussed, okay. So answer is A. With increase in the age, what is true? So remember, with age, there is loss of elasticity. Lungs become more fibrotic, okay. So there should be increased compliance. And that causes increase RV. It will increase. It falls. This also falls. It decreases. This also falls. So best answer is pulmonary compliance will increase. Answer should be A. Okay. Next question. FRC is the air left in the lung after normal expiration because it is ERV plus RV FRC. After normal expiration, again it is FRC. Okay, it will be FRC plus TV because when you normal inspiration you get TV. Okay. Then after forceful it's RV and it will be basically IC, inspiratory capacity. So answer should be B. Yes. Clinical question, again, I don't have clinical question, okay, Dr. Firoz Ali. So when I get clinical, I'll discuss, but they will be discussed by, again, medicine faculty, surgery faculty, don't worry, okay. Tubuloglomerular feedback is by macula densa cells, help in GFR. Macula densa cells. In DCT, they are for GFR regulation, okay. See, tactile best is our Merkel. If they say tactile discrimination, Merkel, Merkel, Merkel. Okay, Manoj, 100% Merkel. Okay. Okay, I'll discuss question number 5 later. Okay. See, it's asking secreted after pucha, after 14 day, acting maximally on project. If after 14, the answer should be LH. Okay, should be LH. Respiratory centers, obviously carbon dioxide is the main for both, is main stimulus. Act on both PC and CC. That is PC and CC. Yeah, anyone can watch because these questions will be repeated in FMG exam also. Okay. What is true for decorticate? So remember, decorticate occur in mid-collicular lesion. So mid-collicular lesion. So mid-collicular lesion in the colliculars, and it is produced by cortex. No. Cortex will cause spasticity. It will cause spasticity and paralysis, spastic paralysis. Flexion of lower, no, it's false. It's false. It is extensor, no. It is flexor, extensor, both. It is mixed, wrong. Upper limb, yes, it's true. So it is upper limb are flexed, lower limb are extended. That's the case. Okay, mainly due to rubrospinal tract. Rubrospinal tract. So we'll go for D. Yes. Calcitonin is increased by. So remember, it is increased whenever there is a high calcium. And then calcitonin would inhibit osteoclast and decrease calcium level. So best answer is hyperparathyroidism. So hyperparathyroidism is the case. So hyperparathyroidism. So that increase the calcium. Hyperthyroidism, calcium not affected much, so you can ignore. Here decrease calcium. So we'll go for C. Yes, C. Anterograde peristalsis. Remember, these three are at the back. For contraction. This is anterograde for relaxation. Okay, so it's anterograde for relaxation. So that's why answer should be D. VIP. Answer is D. VIP. Okay. Vein bridge reflex causes. So remember, when you give IV fluids, it increase sympathetic and that increase heart rate. This is called as vein bridge reflex. So increased heart rate is called as the vein bridge reflex. Vein bridge reflex. Okay. C peptide is seen. So remember, it's a part of proinsulin. Proinsulin is insulin plus C peptide. So that make you pro-insulin. So answer should be this. Okay. A 60-year-old patient with FEN 1.5, 3.5. So let's calculate the FEN percentage. It will be 1.5 by 3.5. So it's less than 50%. How much will come? Around 40%. So it's roughly, so it's a obstructive lung disease. Okay, obstructive lung disease. During exercise, rapid breathing. Remember, pneumotaxic increase the rate of breathing. It increase the depth. VRG is the one for increase rapid breathing exercise. And DRG is normal inspiration. DRG. So best answer is VRG. Exercise VRG causes increase in the rapid breathing rate and depth. Okay, VRG. and also cause apneusis, depth and apneusis, where respiration can stop for some time in inspiration. Slow conduction is seen. So remember, the slowest is A, B, C. C is the slowest and A is the fastest. A is our motor and sensory. This is preganglionic. This is postganglionic. So the answer is postganglionic sympathetic fiber. Okay, so answer is postganglionic fiber. Okay. Last is NEET PG 18 questions. What is the transport of ions is basically by RAN proteins. RAN protein, histones is for packaging mainly. So RAN proteins are running from the, yes, our nucleus to this, and it is basically for transport of substances in and out of the nucleus. Okay, so it help in the, yes, movement of ions and other substances called as the RAN protein. That is RAS related nuclear protein. Okay, so answer should be A. Cabulin is basically, yes, it help in the, yes, process of endocytosis and also store calcium in cabuli. Insulin growth factor, so liver make it IGF-1, and that is the answer. Again, ask in INSCT also this year. So INSCT, okay. In hypovolemic shock, what occurs? So obviously there is vasoconstriction in the kidney, alpha 1. So afferent resistance is increased, that is causing vasoconstriction. So that is causing vasoconstriction. Okay. Output is decrease, false. Efferent constriction, no, it's both afferent, efferent, but best is afferent. Decrease, false. Okay. T wave, again we discussed already, it is due to bulging of the, yes, again it's a PYQ repeated. Again this we have discussed, there is no exchange, no exchange. Okay, no exchange is there. Alpha wave are seen in, again, relaxed state. Awake, eye close, relax. Awake, eye closed, relaxed mind. Relaxed mind. Okay, that's the case. Okay. Component for countercurrent. Sodium outflow in this NKCC, yes. Water outflow, water is not the responsible, no. It is the answer. Sodium outflow, yes. Sodium chloride transport and flow is true, because as it flow, it become iso to hypo and hyper. So true. So answer should be B, because water is not a component of countercurrent. Water not part. Water is not a part, only salts are. Okay, salts. Glucose absorb, I discussed already, its secondary active SGLT1. So best answer is SGLT1. Okay, so iron is absorbed through DMT1 at the apical border, apical luminal border. Apical luminal border, and at the basolateral we have the ferroportin at the basal border. So that's why answer should be D. Okay. Bartter syndrome defect is NKCC, which is in the thick ascending loop of Henle. Again, see, typing mistakes, both are thick, thick ascending. Thick ascending is the answer, C. Okay. Endothelin again cause vasoconstriction through GP, CR, IP3, DAG, IP3, DAG. So they cause vasoconstriction. Okay. So they will be G proteins. Okay, G proteins. Aldosterone is increased by, so answer is decrease sodium, increase potassium, renin. Okay, so answer should be hyperkalemia, not CRH. CRH for ACTH. Hypernatremia, decrease the aldosterone. Steroids inhibit the aldosterone via negative feedback. So with this, we'll finish the session. Okay, I have a 9 p.m. Zoom meeting. Okay, so already it's 9, so I'll go for that. Okay, any doubt you can message me at this number. I will be replying it as soon as possible. because I'm very hectic. Morning I have classes, then I'm having this session, then Zoom meetings. So very hectic. Still, I did my level best to cover all the questions sufficiently. If any doubt, you message me, SMS. I will come to you and I will correct your doubts and problem. Okay. So thank you very much for the session. Okay. Best of luck. Please do all the PYQs, okay, in detail, so that if any topic come, it should be done multiple times. Other subject, important topic also I'll give you a list of important topics. So just message me, I will give and will be published. Okay. So thank you very much. Take care. Good night. So any doubt, please message me. Okay.